The latest data from the state of Indiana shows 7 influenza-associated deaths this season. The CDC estimates there have been at least 4.6 million flu illnesses across the country. The agency reports 39,000 hospitalizations and 2,100 deaths, all from the flu. We told you at 5 o'clock many area hospitals now have visitor restrictions due to increased flu activity. News 10's Tilly Marlatt spoke with a local doctor today. She brings us more on what symptoms you should watch out for and ways to stay healthy.
Many hospitals in the Wabash Valley are experiencing an increase in flu-related illnesses. Dr. Michael Gamble works with the Greene County General Hospital. He tells us about what is coming through the emergency room.
Well, in the past 1 to 2 weeks, we've seen an uptick in influenza-related illnesses. Some of those are influenza A and B. Some of those are influenza-like illnesses.
Health officials say this is not uncommon for this time of year.
Typically, influenza cycles across the country, and sometime between November and early April, we see an uptick in influenza, and this is pretty standard.
Do not expect the illness to go away overnight.
Well, influenza typically lasts 5 to 7 days in a normal infection, so people are going to feel miserable for quite some time, longer than most want.
Gamble says if you are feeling extremely ill, to call your family doctor. Young children and older adults are more vulnerable.
They need to self-isolate, so people should not go to work, should not be out shopping, should not be in daycares or schools. And then symptom treatment for influenza would be drinking lots of fluids, symptom treatment for like cough medicine, and acetaminophen for fevers and chills and pain.
Don't underestimate the power of soap and water.
Good hand hygiene is probably one of the most important things you can do to stay healthy.
Gamble says it's not too late to get your flu shot. In Greene County, Tilly Marlatt, News 10.
Greene County General Hospital, Sullivan County Community Hospital, St. Vincent Clay Hospital, Good Samaritan Hospital, and Daviess Community Hospital all have restrictions in place. This is to help keep patients in the hospital safe. Hospitals ask that you do not visit if you've experienced diarrhea, vomiting, fever, or cough within 24 hours prior. Most hospitals will not allow those under 16 to visit. That's with the exception of siblings visiting new babies who are not exhibiting flu symptoms.